Welcome to the eHAZA training series. In this session, we'll explore the eHAZA homepage, reviewing its key features and how to effectively navigate them. Upon logging into eHAZA, you'll arrive at the homepage where you'll find 6 essential icons: the clinical icon, participant directory, dashboards, case management, device status, and stock management. This video will guide you through the functions and use of each icon. First, the clinical icon. This is designed for conducting clinical assessments and managing health encounters for individuals and groups. This includes assessments such as acute illness, antenatal care, child nutrition, and more. Let's first learn what an individual encounter is about. To begin an individual encounter, click the clinical icon, then choose Individual Encounter. Select the type of assessment you will be completing today. Search for an existing participant by entering their name on national ID or, if needed, register a new patient. For example, let's select acute illness. After selecting a patient, you will be guided through the necessary steps to complete the assessment. This includes symptom review, exposure and travel history, prior treatment history, physical exams, among others. Note that as the healthcare provider, you'll go through these activities with the patient. These will guide the final diagnosis, so be sure to complete all checklists for a more comprehensive assessment. Based on the assessment, eHAZA will generate a diagnosis. In this case, Anael is diagnosed with malaria without complications. You will then proceed with the next steps, which includes treatment and medication, follow-up scheduling, as well as referrals. All completed actions will appear in the completed section. If an activity does not immediately display, refresh the screen by clicking the refresh icon or swiping down twice. After completing all to-dos and next step, you will then see the progress report. Remember that eHAZA encourages the healthcare provider to educate the patient on the results of the encounters seen on the progress report. This allows the patient to own their results and understand what he or she sees on the progress report. And now onto group encounters. Group encounters are used for specific health programs such as the PMTCT program, which is the prevention of mother-to-child transmission for HIV-exposed mothers and infants, as well as the FBF program, which is fortified blended food. To initiate a group encounter, select the clinical icon and choose Group Encounter. Then select FBF Fukura Group as our example today. Check in the participant by searching for individual names or displaying all registered members. Additional group features such as these icons allow for individualized activities within the group setting. A more detailed guide on group encounters will be covered in another video. Now that you're familiar with the clinical icon, let's explore the next feature. The second icon is the participant directory icon. This icon is used for registering new patients, updating demographic information, reviewing progress reports, and establishing family relationships, such as linking a mother to a child. To update a participant's details, select the participant directory icon, then click the arrow next to a participant's name. Select the edit icon to update details such as HIV status, village, and household relationships. In the next video, we will provide a step-by-step guide on registering a new patient in eHAZA. The third icon is the dashboards icon. This provides aggregated data from various health programs using eHAZA, such as child nutrition, acute illness, antenatal care, and NCDs. To view program data, click the dashboard icon, then select which program you want to see, for example, antenatal care. Review real-time sync data when the device is connected to the internet. To view historical data, click the arrow to navigate through past months. The last update timestamp at the bottom of the page indicates when data was last refreshed. The fourth icon is the case management icon. This tool supports follow-up activities including lab results tracking, contact tracing, home visits at the community level, and more. For example, if a patient had an outstanding ANC lab test, it would appear in this section until results are recorded, as we can see in the case of Anita Owase, who has a pending ANC lab result. The device status icon ensures that all collected data is synchronized with the back-end system. Before syncing, ensure your device is connected to the internet. To verify if synchronization is complete, check if the numbers displayed are at 0. Your device has successfully synced with the health center that you are assigned to. Lastly, the stock management icon. This tool helps monitor inventory levels of FBF and automatically updates stock based on quantities issued to mothers and children during visits. You are now familiar with the eHealth homepage and its 6 key icons. By mastering these tools, you can effectively manage patient care, track data, and ensure seamless service delivery. Enjoy using eHealth in your health center.